Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. My guest today is an old friend of mine, Steve Spearman. I've known Steve for quite a few years, and he's always been the subject matter expert I turn to for anything related to HIPAA, security risk of health information, or any really related issue. He's also a well-known educator in the field and has trained many of the current experts. Steve, thanks for joining me on this episode of the Tate Chronicles.
It is a great pleasure to catch up again with you, Jim.
Before we kind of get into details, just kind of an initial thought I have, Steve, is some of the biggest names in healthcare have been in the news recently due to security breaches. Probably the most prominent one has been Change Healthcare, because what happened there affected the ability of providers to electronically submit billing. And so they had just incredible crises around cash flow. So this is really a topical thing to have you here today, Steve. But first, let me kind of deal with some of the general things. It seems to me that the threats to protected health information come in several areas of vulnerability. So let's kind of break those down a little bit. The first is actual data breaches. So what do you have to say about that?
Well, I want to just mention something about Change Healthcare. I mean, Change Healthcare is actually an example of the cascading effect that a breach or a ransomware attack in this case can have. As you know, Change is owned by United Healthcare, and their companies that are even a lot of small clinics that are having to declare bankruptcy because they can't they cannot get paid, which is just so. It's I think actually Change is one of the most significant breaches that we've ever seen in healthcare. I mean, it's just incredible. And my sympathy. There may be some people here that have been affected by that. My sympathies go out to you. It's like this is a tough time, and it does highlight the importance of being able to put into place the things to prevent this kind of attack from happening. But but in the case of those clinics, they're literally just victims. I mean, and so I think things are slowly getting better, but it's been really bad.
Well,
yeah.
Well, and I want to say, Change, I guess, is a good example of a data breach, the unauthorized access to this personal health information. I don't know if they actually stole information or they just infiltrated the network, so it had to be shut down. What happened there?
It was a ransomware attack. I'm with a high degree of certainty. One of the things that I've been saying for many years, actually, as a part of my day to day, I do a lot of training. We can maybe talk about that later, but I actually pose a question to my students. Like, if you think about security, it's about protecting against its confidentiality, integrity, and availability. And I pose the question, I say, do all verticals value those three things equally? And of course, the answer is always no. It's nothing straightforward. And I'll typically say, in healthcare, which one do you think is most important? And most people will say confidentiality, because they think about HIPAA, and that's what HIPAA is all about, is protecting. And it's true, it's important. But I actually think that the correct answer is availability, because the lack of availability, when a healthcare provider can't get access to a record, people die. People and there's actually been some structured, informal survey work to actually make an estimate of how many patients in the U.S. have died as a result of ransomware attacks. And the answer is, there's a range of different surveys that have been done, but most of them say 100 to 200 people have actually died as a result of ransomware attacks. If you're in the healthcare environment and you give somebody an antibiotic that they're allergic to and they go into anaphylactic shock and you can't address that quickly, you die. And so it's like and so change is an example of why I think ransomware has been the most significant change in the last 10 years to actually promote some of the things that are really positive that we're seeing in cybersecurity and healthcare, which is more money spent on cybersecurity. Like this is prior to, and Jim, I don't know if we've talked
Mm-hmm.
about it in the past, but remember the first notable ransomware attack in healthcare was Hollywood Presbyterian in Los Angeles. That was in 2014, I believe it
Wow.
was,
Mm-hmm.
and they demanded an $18,000 ransom in Bitcoin, which Hollywood Presbyterian paid, and then ever since then. But prior to that, you might have like the corner offices at a healthcare entity might say something. Well, a breach would be bad. I mean, I'm not saying a breach would be, terrible. It would be terrible, but we'd get through it. We'd pay the fine or whatever.
Mm-hmm.
If you have a ransomware attack, you cannot operate. You have to DCH health system in Alabama, three hospital health system, was literally nearly unable to operate except using manual processes for 2 weeks because of a ransomware attack. So breaches are, I'm not, and by the way, ransomware attacks are breaches. I do want to make that they're kind of a
Sure.
category of breach
Sure.
because this is actually an area that around, when I was doing, in the consulting world around 2018, where you'd have a CIO or director of IT at a hospital say, well, yeah, they ransomed our data, but it, quote, wasn't a breach. And the
Mm-hmm.
idea being that no data was being disclosed. And then the Office for Civil Rights published guidance in 2018-19 saying, hey, a ransomware attack is a breach.
Mm-hmm.
It is a breach because you can't. I think there's this perception that ransomware is just out there ready to leech on and it's virus in it. But successful ransomware attacks always involve active hackers. They might take advantage of a virus that or a bad link in a website or something, or a phishing threat to make to foment the attack. But eventually, somebody's going to have to go in there and actually breach your network.
Gotcha.
And the
Yeah.
bad guys have made this question sort of superfluous because now ransomware attackers they're literally publishing data. They're saying if you don't, if you in protected health information, if you
Mm-hmm.
don't pay the ransom by Thursday at 2 a.m. or 2 p.m., Eastern time, we're going to start publishing protected health information. And then the question becomes, you've got a breach. There's not going to be any way trying to argue out of it.
Right.
So,
Well, let's talk just a minute about insider threats. So whether employees or contractors who have access may intentionally or unintentionally disclose or allow access. How often does that happen? Somebody at a hospital may get an email, and they click on it and it introduces some malware.
And it's worth noting that insider threat a lot of time I actually like how you set the question up, Jim, because we tend to think of insider threats as malicious insiders. I'm not saying it's unheard of in healthcare. In fact, I'm sure there are many stories you could find of malicious insiders. But as you point out, probably the most significant insider threat is an employee, possibly a great employee, making a big mistake that has enormous ramifications, like somebody clicking on a malicious link, or but a lot of times it can be malicious, but it can be clear violation of policy, like a doctor or someone saying, hey, hey, I want to give you my, credentials. So, credentials, because I
Mm-hmm.
don't want to have to, I don't want to have to get up this chart, with
Right.
myself. I actually had many years, probably about 6, 7 years ago, I had a client that literally they had baked the sharing of authentication information into their operations.
Oh, wow.
It was a large orthopedic practice, and the doctor just wanted to be able to go into the room and like open up and have the chart already there. And so they gave their credentials to the nurse. The nurse would go in, open the chart, bring it to the right page, and then the doctor would just sort of walk in. They did. It's almost weird. It's like we don't want to be seen as having to like do something on a computer. I don't know. Now it has gotten better. Let me sort of say this. Many more health organizations have adopted single sign-on with secondary, like with the two-factor or multi-factor authentication, like smart cards or whatever, to really kind of make those sort of processes less onerous, but it's still an issue. But insider threats, you need to actively have as a part of your cybersecurity planning how to deal with and prevent insider threats, whether they're malicious or people making mistakes.
Another area, and I had never thought about this until a few years ago, Steve, when we were working together, and you were doing some. We were doing some mock security risk
Yeah, the
audits.
risk assessment. Yep.
Yeah,
Yep.
we were doing those, and the idea of improper disposal. And the thing you brought up is the large copy machines often are taking an image of everything that's copied, and there's a hard disk in there that has everything that's ever been copied. And people
Yeah.
get rid of those and don't realize there's a hard drive in there with all that
Yeah.
data, images.
Yeah. 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 The I want to about some years ago I wrote an article that I posted on LinkedIn where the person saying, "Hey, we're buying this high-end, copy machine, and they're telling us we need the quote unquote HIPAA version." And that we have to buy it as a healthcare provider. And the point being exactly what you're saying is that high-end copy machines make images or copies of everything that goes on there, and companies need to make sure that they properly secure the drives before they turn over a copy machine. And in fact, there was a local television station in New York that did a research piece. They just went in and randomly bought like several used copy machines. And
Mm,
there was a company that had there was a company that was a towing company, I think a police department, but one of the ones was a clinic, and they were able to get massive amounts of protected health information off the drive on the copy machine, to the degree that they even had to declare a breach. I believe that they were and that there was even a public resolution agreement with the Office for Civil Rights over that. So, and that's an example. Improper disposal. It can involve physical, like improper disposal of physical assets. You don't see this much anymore, but there was a period of time where you and I were talking, more frequently, where everybody was transitioning to electronic health records, right? Because of
right.
the whole meaningful use thing. And companies are saying, "Hey, we don't need all these paper records anymore," and they were dumping them in the dumpster. And that's a violation of HIPAA. Curiously, it's a violation of the HIPAA rule. I'm sorry, the privacy rules, but not the security rules, because the
Mm-hmm.
security rules only involve electronic protected health information, but still a significant risk. People need to think about physical security as well. And I actually think more today, like for example, back in the day, 8 years ago, when along the years after we first met, insecure hard drives or like
Right.
devices that are stolen was probably the number one risk. It's just not something you see much anymore. Almost all devices are routinely encrypted. And so you just don't see that kind of breach like you used to.
Let me mention to our listeners, if you're just joining us, I'm Jim Tate. On this episode of the Tate Chronicles, I'm speaking with Steve Spearman of the CyberCertAcademy, and we'll get into the details of that new initiative you're doing in just a few minutes, Steve. Um, you know, 10, 15 years ago, security risk analysis, of course, when things were in paper, it wasn't that big a deal, but once it became electronic, and so there had to be a cultural shift of could no longer do a wink and a nod about securing health information. And so it's become more and more important, not only because it's the right thing to do, but the type of fines and, that for violating regulations from the government, but also opening yourself up to outside attacks. But let's talk a little about AI. So is this something that bad actors are going to use or are using to access or attack healthcare systems? And the flip side, can it be used to detect and defend against such intrusions? What do you think about that?
So the answer is yes. Yes to both.
Okay.
Let's sort of talk a little bit about the risks,
Okay.
the hacker side. Now, if I were to talk to most of your listeners and say, hey, what historically has been the number one defense against a phishing attack, as an example? If I were to ask any of your users, I'm going to give them just a moment, just think about, okay, 5 years ago, you had a risk about phishing attacks. What was your main countermeasure to that? And of course, the answer is training, right?
Right.
We go
yeah.
in and we say, and when you think about that training, what is it you were training for? Punctuation, spelling errors, weird syntax or whatever. That all of those typical. I'm not saying training is no longer important. It is very important, but that kind of training is either no longer relevant or is very soon not to be relevant. If you could be a person in Thailand, you may not speak a lick of English. You could write a phishing email in your original language and ask ChatGPT to convert it and format it properly as an email that somebody might receive at a healthcare organization in the United States, and ChatGPT will do it. Now, ChatGPT is supposed to have rules to kind of prevent this sort of thing, but they're fairly easy to get around. In other words, those typical. So ultimately, what my point is that those kinds of defenses relying on people to recognize poorly written email, that phishing emails, that's going away. We're going to have to use more technical. We're going to still need phishing, and one of the things that I think phishing related training, but you need to start training people that say, hey, just because an email looks extremely valid, like it's really well written and it's really well written, and hey, it actually references something on my LinkedIn profile, doesn't mean it's real. It's like we're going to have to take what we've done, which is sort of the easy part, and we're going to have to get people to use sort of a zero trust model for everything that comes into their inbox. Now, so we're making that challenge, but I think more importantly is you're going to have to organizations are going to have to rely on more technical solutions like email filtering, advanced threat protection, using like technical solutions like DMARC, that's domain-based message authentication reporting and conformance, sender policy frameworks, domain keys, identified mail, DKIM, to verify authenticity of emails. Another one, where getting to the positive side of AI, is there's been technology in the last several years that has really, I think, made a big difference, known as different, that can take the form in both in the intrusion detection systems, as well as in what's known as a SIEM or SOAR. A SIEM is Security Information Event Management, and SOAR security operations and security operations. Oh gosh, it's I'm having a little bit of a moment, but
Sure. Yeah.
it's and essentially these tools have embedded with them looking for unusual behavioral. So it's known as heuristic or behavioral analytics,
Okay.
and it are solutions that will look for behaviors that just go contrary to a baseline of behaviors. And this could be human behaviors, or it could be network behaviors. Something on the network is going on that's not right. It's easier for me to illustrate the human side. Like, let's say you have a hospitalist. The hospitalist has a typical schedule of getting in at 7 in the morning and leaving between 6 and 6:30 Monday through Friday. She also is required to work, weekends every 3 weeks. She does not keep clinic hours because she's a hospitalist. Blah blah blah. This is what her baseline of behavior is.
Sure.
And then let's say all of a sudden one evening at 2 a.m. from home on a Tuesday, she's actually remoting in to the network, to the protected, to the EMR, EHR from home over a VPN. That might invoke a heuristic response.
I see. Sure.
And it may be completely legitimate. It may be legitimate, but using those kinds of tools, can help fight this. And one of the ways that AI is actually, those heuristic tools have been in development for 10 years or so, and they've made, they've helped. But AI is helping to like kind of sharpen the validity, to prevent false positives and to detect real events in a way that I think is pretty important. So that's just an example. I mean, AI, we've sort of explored what it can do on the negative side, but on the positive side, it can really sharpen the tools that we do have available to help us fight these kinds of attacks.
Steve, we only have about 5 more minutes, and I want to get to something that's very important to me. There is no doubt there are not enough really expertise to cover the whole area of security of health information networks. So folks have to be trained as new risks like AI come into play. That training has to be updated. And so for somebody who's interested in the healthcare security field, what type of education and training is available? Are there certifications? And I know you've been very involved with this, so I'd like to hear your thoughts on this.
Yeah. Well, let me kind of start from a general and get a little specific. But from a general standpoint, many of your listeners, that especially if they're in health IT, may or may not spend their days, may or may not spend their days in quote cybersecurity. But if you do health IT, there is a path for you to get into cybersecurity, which is going to be, you look at the HIMSS 2023 HIMSS cybersecurity survey and other things. Budgets are increasing in healthcare, even though they're also simultaneously saying one of our big problems is the lack of qualified personnel. So there's definitely a path towards, so I've started a company called CyberCertAcademy, and I do want to sort of say right now we haven't even launched. I think by the time this podcast is live, we will have launched. But my focus is on actually helping people get cybersecurity certification training, actually to pass those certification exams. And the one initially that I'm focusing on is the one that's most in demand. It's known as the CISSP So, and I'm, literally we're a startup. So I'm the instructor for all of these classes going on in the near term until we can sort of build that out. Here's my non-cynical take on
Okay.
the CISSP. The CISSP is very valuable for a person that wants to make a living in cybersecurity. If you go onto, if any of your listeners to go in and say in LinkedIn jobs and put in CISSP required, you're going to have hundreds and hundreds of jobs come up where
Wow.
it's a requirement that you have some sort of certification.
Mm-hmm.
But I do want to say a certification doesn't make you an excellent cybersecurity professional. Your listeners need, and one of the things in terms of my mid to long term vision for CyberCert Academy is that I want to actually provide a learning path to the learning path to people that want to actually develop more of the skills necessary in some area of niche area within cybersecurity, such as they really want to do analytics, or they would like to get into ethical hacking,
Mm-hmm.
also known as pen testing or whatever, that we can sort of help craft paths for them to do that. But the CISSP is a management exam. You don't have to have 5 years of management experience, but you need 5 years of some sort of cybersecurity experience to be able to become a CISSP. But I like to emphasize to my students that you can become a CISSP even if cybersecurity has not been your focus. If you're in healthcare IT today, you are involved in cybersecurity. You're
Mm-hmm.
doing something, related to that, and you can use that experience to help you kind of transition your
Sure.
career.
Sure.
Just to bring it back around, the demand is huge. I mean, it's one of the big problems reported in the HIMSS 2023 cybersecurity survey.
Sure.
Uh,
Well,
is the is
yes,
so certifications is a great place to start, but then
gotcha.
you can also proactively think about what are the areas you want to
Sure.
specialize in, and then seek very much more hands-on type of skills
Sure.
there.
That's the foundation. Well, Steve, before we say goodbye to our audience, what's the best way for folks to contact you to find out about the training you're doing?
Yeah, so my website is CyberCert, that's CyberCert Academy.com. My email is steve@cybercertacademy.com. If any
Great.
one of your listeners are interested in earning their CISSP, we are going to have our first boot camp in June. The boot camp is a 6-day intensive to help you pass the certification exam.
And that
And
that's remote. That's a virtual.
that's this. We're going to be doing some on-site classes as well,
Sure.
probably first one in August.
Okay.
And we'll, and just so if you go in and you register on the website, we'll keep you posted on updated class schedules and things like that.
Great. Well, to our audience, thanks for joining me on this episode of the Tate Chronicles. And I offer a special salute to my guest today, Steve Spearman, founder of the CyberCert Academy. Steve, thanks for coming aboard today.
It's a great pleasure, Jim.
You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.